Welcome back to This Week in Global Health, otherwise known as TWIG. TWIG is a weekly live global health news roundup. We're a live show, so if you're watching this live, please feel free to interact with us. Send us a tweet on Twitter using the hashtag TWIG, TWIGH, or you can get us at TWIG Team on Twitter. You can also email us using hello@twig.org. All right, we're going to be talking about MERS. Very exciting, very topical. It's in the news. Everybody's interested. I'm interested. So let's jump right in and start off with the show. And I'm going to ask Jessica. Jessica, could you just give us a quick, in a nutshell, what is MERS?
All right, so MERS. People probably heard a lot about MERS. Well, MERS stands for the Middle East Respiratory Syndrome. It's a coronavirus, and it causes a disease, which is a viral respiratory syndrome. And it was first identified in Jordan and then in Saudi Arabia in 2012. Okay,
and we hear the word coronavirus, and that rings a few bells. So we've heard of coronavirus before. Terry, could you remind us where we heard this word before? What bells are ringing in my head?
Well, I'll tell you a bell that's ringing in my head. Corona is a beer in the United States, a very popular beer, and it's actually from Mexico. But same pronunciation, coronavirus. And the reason we hear about this, Greg and everyone, is that this is about 30% of our colds are from coronaviruses. And so that's why it kind of appears to be common for us. And bear in mind also, if we look back at SARS about 10 years ago, 2003, 2002, SARS was also a coronavirus. For those that can't remember, SARS is in fact the severe respiratory syndrome. So severe respiratory syndrome disease. We found that it migrated from Hong Kong.
Well, Terry, while you're at it and you're mentioning corona, let me also mention coronaviruses get their name because corona also means crown. So
yeah, that's what I was going to say. See, the scientists think alike.
Okay, I'll introduce you all to the other corona when we're together in the same country.
Okay. I'm looking forward to that because for those of you that haven't watched the show before, none of us have actually ever physically met. Well, I haven't met anyone on the team. The other guys have met from time to time at different conferences, but I'm a little bit of the odd one out in that sense. I've never met any of them, to my detriment, of course. So, Sulzan, could you just quickly talk us through how many countries are affected? Where are we now? What's the story? What's the lowdown? What's the word on the street with MERS?
Definitely, Greg. So far, 25 countries have reported cases of MERS, and the latest being the outbreak in South Korea, which, as according to the latest figures, has infected 162 people and killed 20. So far, 36% of people who got infected with MERS have died. So there is a lot of worry, across the world about is MERS going to be the next SARS, considering they're from the same family. So 25 countries across the world.
Yeah, I think that is, you're absolutely right. I think that is what people are concerned about, is this, especially given we've just come through it, when it's not even over yet, the sort of Ebola crisis in West Africa. We're seeing a new virus now. Everybody's a little bit nervous. We're hearing from the WHO that there's nothing really to worry about in terms of, like, this is not a public health emergency of international concern. But I think people hearing that from the WHO, given what we've just seen recently, maybe doesn't hold as much water as it might have a few months ago, and so there is a little bit of concern, but we're going to talk about that in this episode. We're going to talk about realistically, like, how likely is this to spread and become sort of a pandemic that we need to be worried about. And the short answer, here's a little heads up, it's unlikely to actually ever be anything to lose sleep about if you're just a regular civilian living somewhere in the world. But anyway, we'll get into that. I've probably kind of gone ahead of myself. Terry, the transmission of MERS. How is MERS transmitted?
Okay, well, Greg, that kind of goes along with your introductory comments. We don't know a lot about this yet, but we're starting to figure out, one, we believe that close personal contact is a necessary element to occur. Think about where that might occur within families and also institutions, more so I suggest hospitals. And so we look at the transmission of it, we're figuring that out. We do believe that the reservoir, in other words, where is this held, that it's part of the camel population. And that's our reservoir for the disease. So it's transmitting from animal to human. where for those who might be in the, when they think about protecting themselves, just normal protections are in order. Sneezing, cover your mouth. Wash your hands, just normal protections. This is not something to have great fear about, but certainly for something that we should be looking at.
Yeah, and I think, and we may talk about this more during the show, but it's certainly the people that are at risk, and I think you alluded to this, Terry, are healthcare workers. So a person arrives in a country, or maybe you're in a country where there is MERS, healthcare workers that have very close contact with patients. And this is what we're seeing, it's really healthcare workers that are at most risk, and of course family contacts, those close contacts. And as you've said, Terry, it's those normal precautions that you need to take in terms of any, if anyone in your family had a cold, what would you do? You'd avoid respiratory droplets. You would avoid getting sneezed on. You'd wash your hands, etc., etc. The R0, I think I heard Sulzan talking earlier for MERS is 0.7. Is that right? Sulzan, I don't know if you heard me. Anyway, so the R0, I think, is 0.7. And what that means, the R0 it's an epidemiological term, and it refers to the number of people who are likely to get a secondary infection from a person that has a disease in a totally susceptible population. Okay, so if the R0 is less than 1, a disease will burn itself out. If it's more than 1, in other words, if for everybody that has it, more than one person gets it, it'll turn into an epidemic and will spread. All right, so in this case, from what I understand, MERS has got an R0 of less than 1, and so it is an epidemic that, given time, it actually should burn itself out. But that's just, I think I just overheard someone saying 0.7. Maybe Sulzan can correct me on that.
Yeah, no, you're right, Greg. So the R0 of SARS, and in the community setting is actually 0.7, according to a latest study which studied the outbreak in Saudi Arabia. However, in nosocomial setting, as to see what happened in South Korea, which means in the hospital, the R0 of SARS is like 6 to 7. So which basically means that it's an infectious disease that is nosocomial, and maybe because, like Terry mentioned, people in those hospitals weren't washing hands, there was overcrowding. So those could be the reasons attributed why MERS was able to spread very quickly in hospitals. But in the community, it's definitely less than 1, as you mentioned.
Less than 1 in the community, more than 1 in a hospital setting. And just to put a little bit of light onto some terminology that we've used, if you're not familiar with it, we've used the word zoonotic. So a zoonotic infection or disease refers to a virus whose regular host is an animal. And I think Jessica's going to talk a little bit about, in this particular case, in the case of MERS, where this comes from. I know we've heard about camels, but that's going to be an interesting discussion. So a zoonotic infection, the host is usually an animal, and it can cross and infect human beings. The other word that you just heard from Sulzan is nosocomial, and nosocomial kind of means hospital-acquired, so a disease that you get while you're in hospital. And in the case of MERS, it's very often that the hospital staff themselves that are at risk. I'm going to ask Matt if he can talk about travel and travel advice. There's been a lot in the news recently about travel and some stuff that the WHO said. Matt, over to you.
Hello, everyone, and I have an article from the Associated Press that I would like to share. Since our focus today is on the Middle East Respiratory Syndrome, or MERS, I would like to highlight this story. It's also featured on globalhealthnow.org. This article, again, Associated Press, stated that the World Health Organization reports the recent outbreak of MERS in South Korea does not warrant labeling of global emergency. However, both the United Nations and the World Health Organization suggested this outbreak is a wake-up call, and that more investigation is needed. In this article, Dr. Furuka, Assistant General Director at WHO, was interviewed. Dr. Furuka stated that, quote, there was no proof MERS had mutated into a more dangerous form in South Korea. As of today, there are less than 500 people who have died from MERS since 2012. Dr. Furuka added that if MERS shows up in the inner cities of one of the developing world megacities, then we are in real trouble. We will provide this link to the article along with additional MERS information on the twig.org site.
Okay, thanks very much, Matt. I think that's actually quite a nice distinction. I mean, I think, I live in Dublin. Were MERS to come to Ireland, the people that need to be alerted are really the healthcare workers, the frontline workers who will be in really close contact with a patient, and then of course family contacts, and you know, the departments of public health here would jump on that. Very different story if
did we lose Greg? Looks like we did. Okay. I'm not sure if we're still live, but if we are, Greg is going to be back really soon. And as you know, like this, this probably means that, you know, we are live. So talking about, as Greg was mentioning, and as Matt mentioned regarding the travel advisory, you know, as has not the primary concern, what that means is that travel and trade restrictions are not advised by WHO. It's sad that some countries, such as Hong Kong, have decided not to heed that and have still placed travel restrictions in Saudi Arabia and South Korea, which often leads to a very you know, escalated economic impact on those countries. So that's the biggest problem that we see with a lot of diseases, you know, whether Ebola, whether MERS, which basically what Greg mentioned has a lower R naught. So Jess, what do you think about like the travel restrictions and what, you know, Hong Kong not heeding the WHO's advisory?
Oh man, so many thoughts. Okay, I think every country needs to do what they need to do. I'm a little concerned that we have not. All right. I don't necessarily think that we need to call this an international public health issue right now, but I do think we need. I very much agree that this is a huge wake-up call. The virus went from the Middle East, where it's really been, and granted, we have seen some imported cases in other countries and continents, so we have seen that already, but now we have an outbreak. The virus went from the Middle East to South Korea and caused an outbreak. So this is an absolutely huge wake-up call. I think we need to be putting more attention on this. I think people, you know, healthcare workers in these all over the world need to know what this virus is, how you're going to diagnose it, how to prepare for it. So short of calling it an international public concern, we need to be doing something about this.
So
yeah,
also,
so like, but it's not an, yes.
Describe to us the economic impact. What does this mean for Korea and travelers?
Yeah, so as I mentioned, you know, it's not a public health emergency. It's not considered. So there is no travel or trade restriction advised. But still, this outbreak has already impacted South Korean economy and tourism industry very drastically, Terry. In fact, the Korean Tourism Organization just said recently, I was reading, that in last 2 weeks, 67,700 international tourists from over 30 different countries canceled their visits to South Korea because of MERS. And to counter that, in fact, South Korean government has decided to give like a $3,000 US dollar insurance to tourists if they contracted MERS in the country to encourage them at least to come. But still, like, you know, the ramifications of such, you know, advisories such as Hong Kong not to go to South Korea are huge. In fact, SARS epidemic, which, you know, in 5 months, it cost over $40 billion worth of economic damage, which, you know, because people were really scared to travel. And that is just not needed, especially with MERS, which is not as infectious.
But
yeah, it's very interesting. Terry, I know you are someone who has a deep interest in health systems. And, you know, whenever we talk about these epidemics and pandemics, everybody kind of, health systems comes up. Would you make a comment about, you know, what systems need to be in place? What do countries need to strengthen in order to be resilient or be, you know, to protect their populations against the possible impact of an epidemic like that we may see from something like MERS?
So Greg, you're correct. In fact, previous Twig shows have had people on talking about health systems. It was part of the World Health Assembly. In fact, they said Ebola would have been different if we had invested in health systems. And so the unique thing, or I shouldn't say unique, the positive of this outbreak that we are experiencing in South Korea is that they're noted for having good health systems. And so they have good robust infrastructure to be able to capture, manage, and address this outbreak that they're experiencing. That's a lot different than we will find in other developing low-income, middle-income countries.
Yeah, absolutely, absolutely. And I think, we've talked about health systems, as you said, again and again and again. We've reflected on the fact that health systems that were weak in West Africa during the Ebola crisis, that was, the underlying pathology, so to speak. Does anyone on the panel have any other additional comments they want to throw in about MERS at this point? Is there anything we've left out? I know I dropped off the call a little while because I have a crappy internet connection. So have we kind of covered all of our bases?
No, let me cut in and let me tell you the zoonotic issue about this. So
good. Yeah. Yes, let's hear about that.
So in lieu of I have not giving it like one of my regular science updates, but it is going to be sciencey. The big issue with this virus is that we've been trying to figure out what the reservoir is. This is not a virus that's just hanging out in humans. It's not a natural virus to us. So where are we getting it from? And like Terry said, camels have been suspected, and there's a lot of evidence. They've found the virus, the MERS virus, in camels over and over again. They've linked it to human viruses and human to camel or camel to human transmissions. There is evidence of that. Now, there was just recently a paper that came out in Emerging Infectious Diseases that swabbed, I think, over 800 camels between April 2013 and May 2014, and they found that almost 30% of the camels tested positive for the virus. And they also found that in the carcasses and dead camels, over 60% of them had the virus, they had RNA for the virus in their lung samples. So there's plenty of evidence, but most recently there's also been speculation of whether it comes from bats. Now, you know that bats harbor the SARS virus, so there's reason to suspect. And the bats also have more ancestral-like and MERS-like viruses. Now, recently there was a paper published in Journal of Virology that showed that 2 mutations are enabling bat-human transmission. Now, because I would just want to be very, very careful with this, because I read this paper and I just read the abstract, but they were making a very strong statement that this confirms that, this is how you can get bat to human transmission. And I just want to say that hasn't been confirmed yet. So I still think we're really trying to find out what the data is on humans, what the source is, whether it's bats or camels. So we don't know yet, but there's strong evidence, at least with the camels, I think.
Okay, thanks very much, Jessica. And I think it's clear that there's still a lot of science that needs to be done. There's more research. We need information upon which we can take policy decisions and put together public health interventions. That's all we're going to do for tonight. Obviously, there's more to tell about MERS, and what we're going to do is we're going to put some links in the show notes so you can click on them, and they'll be taking you to different parts of the internet with more information if you want it. Just so that you know, obviously, we've got a website, www.twig.org, twigh.org. You can email us at hello@twig.org. We've got a Twitter account at Twig Team, or use the hashtag Twig, and we will respond. We're on Facebook, we're on YouTube, obviously, because you're probably watching this on YouTube. We've got a podcast, we're on LinkedIn, and we're on Instagram. So feel free to subscribe to our YouTube channel, and of course subscribe on our webpage to our newsletter, and we send the show notes out on that. Thanks everyone for watching. Come back again, same time, same place next week. Until then, don't do drugs, always do your best, and don't ever change. Thanks for watching. Take care.